Hello, everyone. I'm Dr. Lanette with AIMRRA, the American International Medical Record Review Association. Have you applied for a HEDIS job but still are not getting interviews? You may have updated your resume, you may have healthcare experience, you may even understand the basics of HEDIS, but employers may be looking for something more. Stay to the end for a special opportunity to receive a 3-career focused program. So, one question I hear often: why am I applying for HEDIS positions but not getting hired? Well, there may be several reasons, but one common challenge is that applicants sometimes focus on only one skill. They may understand HEDIS but not coding, understand coding but not be confident with medical record review abstraction, or know how to review a chart but not understand HEC, CDPS, risk adjustment, or documentation validation. Combining all 3 areas can help someone stand out in a competitive job market. HEDIS review is not simply reading a medical record and checking a box. A strong reviewer may need to understand what documentation is acceptable, where to locate required information, how to identify dates, diagnosis, procedures, and exclusion, how coding supports quality reporting, how ICD-10 CM codes related to documented conditions, how risk adjustment and HCCs affect healthcare data, and how to recognize incomplete or conflicting documentation. Now, can a person actually review a record? Understand the coding language, recognizing supportive documentation, work across HEDIS, quality, coding, and risk adjustment teams? And the answer is yes. And you can be that person. You can become productive with proper training. The more of these skills a candidate can demonstrate, the more value they may bring to a healthcare organization. So HEDIS focus on healthcare quality and whether members receive recommended services. Coding helps describe diagnosis, procedures, services, and documented conditions. When you understand both areas, you can review a medical record with a broader perspective. So you're not only asking, was the service completed? You may also be asking, is the diagnosis supported? Is the documentation complete? Is the coding consistent with the record? Is there an exclusion? Is there evidence of screening, treatment, or follow-up? Could a documentation issue affect the final outcome? So that broader understanding can help you improve accuracy and confidence, and also, guess what? Earn more money. So what is risk adjustment and why risk adjustment matters? So risk adjustment helps account for the health status and expected healthcare needs of a patient population. Professionals working in this area may review medical records to determine whether documentation diagnoses are complete, accurate, and properly supported. So does that documentation meet the MEAT, M-E-A-T, monitoring, evaluation, assessment, and treatment? Does that documentation support it with the codes, or does those codes support the documentation? That means understanding ICD-10, CM coding, HCC concept, documentation requirements, diagnosis validation, chronic conditions, provider documentation, and compliance and auditing principles. That's going to make a big difference. But when you combine HEDIS review with coding and risk adjustment knowledge, guess what? You're going to be unstoppable. You're building a more complete healthcare skill set, opening doors to HEDIS medical record review, quality abstraction, medical record auditing, risk adjustment review, coding validation, healthcare quality improvement, clinical documentation, compliance support. All these other job positions it's available to you. So training does not guarantee employment, but developing relevant practice skills can help you become a more prepared candidate. Not only that, with the training, you earn your certification, not a certificate, your certification from an accredited agency, okay? And then on top of that, you have it in many different aspects: HEDIS, risk adjustment, coding, right? and auditing. I mean, you can't get any better than that, guys. So this is why AIMRRA created a special 3-for-1 career training opportunity. Through one enrollment, participants receive access to 3 career-focused programs: Certified Healthcare Record Reviewer, Certified Risk Adjustment Auditor, and Certified Risk Adjustment Coder exam prep. So instead of learning one isolated skill, participants develop a combination of skills that work together. Reviewing medical records, understanding HEDIS measures, interpreting healthcare documentation, strengthening ICD-10 code knowledge, and understanding HEC, CDPS, reviewing risk adjustment documentation, preparing for coding and auditing responsibilities, and communicating that knowledge during the interviews. And also, with that knowledge, also gives you the opportunity to be able to negotiate your salary. This is more complete professional foundation. This is not just a stack of certifications. So let's talk about the Certified Healthcare Record Reviewer Program. So this program helps build knowledge in medical record review, HEDIS chart abstraction, healthcare quality measures, documentation standards, and helps review accuracy and real-world case analysis. On top of that, guess what? You're helping that facility, that health plan, you're helping that organization to receive more funding, more money coming in. So this training is designed to help participants approach medical records with greater confidence and structure in data abstraction. Now, Certified Risk Adjustment Auditor. The name should tell you what it is. You're going to be ordering the medical records. So now you know how to abstract the medical records. Now you're going to be able to audit it for risk adjustment. So this program focused on risk adjustment concepts: HEC, CDPS, foundation, documentation review, auditing accuracy, coding and compliancy, and identifying documentation gaps, right? We got to make sure we close those gaps, guys. This program helps participants understand how diagnosis and documentation affects risk adjustment auditing. So now we add our third, CRC exam prep. So the CRC, which is Certified Risk Adjustment Coder exam prep program, helps prepare for the Certified Risk Adjustment Coder examination through instructor-led training. And guess who's going to be training this program? Me. I am. We're going to be training on coding concepts, risk adjustment principles, practice questions, review strategies, and realistic case scenarios. So this CRC credential itself is awarded by AAPC. After a candidate meets its requirements and passes examinations, AAPC will give you that CRC certification. So AIMRRA provides exam prep for that credential, but AIMRRA does not issue the CRC credential. I am an AAPC licensed instructor and also worked as an HEDIS manager, quality manager, HEDIS director, risk adjustment director. So I know exactly what these organizations are looking for. And on top of that, I love to train. So why should you consider this program? This opportunity may be a good fit for nurses interested in medical record review. What if you're not a nurse? What if you're a medical coder? What if you're already a HEDIS reviewer, but you want to get your feet wet in coding? Okay. What if you're not even a HEDIS reviewer, a medical coder, but you're just a healthcare professional and you want to be able to make more money? This course is for you. All right. So a medical coder, HEDIS reviewer, quality improvement professionals, medical record auditors, risk adjustment professionals, healthcare administrators. You know how many healthcare administrators are worked in and they didn't even know what HEDIS is and why it's so important for the organization? Or they did not understand the concept of risk adjustment. Okay, even for providers and physicians, this is very important. And I usually hear physicians and providers says, I didn't go to school for coding. I didn't go to school for this. I went to school for medicine. So, but why is this important? And I'm going to teach you those tools. So it may also help experienced professionals who want to expand beyond their current specialty. So for an example, a HEDIS reviewer may want to strengthen coding knowledge. A coder may want to understand HEDIS and medical record data abstraction. A nurse may want to transition from the bedside into more opportunities, like working from home. So before COVID, a lot of these HEDIS positions, a lot of these even coding positions, was a high percentage was performed at home. And even if you are an auditor, may want more experience with risk adjustment documentation. So as you complete your training, don't focus only on earning certifications. Focus on being able to explain your skills, right? I tell people all the time, why are we going to get certified? Why are we getting all these certifications? So we can get a job, not just so we can have all these credentials behind our names. We need to get a job, and we need to get a job that be able to help us sustain through life, right? Good amount of money getting paid. So you got to be focused on explaining your skills at an interview. Being prepared to discuss how you review a medical record, how you maintain accuracy, how you identify missing documentation, how you interpret diagnoses and codes, how you understand HEDIS measures, how to recognize HCC and CDPS related documentation, how you can close that open care gap, how you handle conflicting information, how you protect patients' privacy, and how you meet productivity and quality expectations. So, employees are often interested in what you can do, not only what course you completed. Training should help you speak confidently about your knowledge and apply it to real world situations. So at this training, you're getting hands on. So you're not only you're getting the instructor led, you're getting the physical books being mailed to your home. You're getting the ICD-10 official approved book mailed to your home. You're getting a workbook mailed to your home. So for a limited time, 3 programs, 1 price. That's what AIMRRA is offering you. So we're offering the CHRR plus the CRAA and plus the CRC exam prep. That means developing skills in HEDIS review, healthcare record review, coding, risk adjustment, auditing, all through one career-focused bundle. And it is designed for professionals by a professional. Who don't want to remain limited to only one area of healthcare, right? We want to go higher. We want to make more money. Let's just say it. We love, I love patient hands-on care. I love working, but I love working to be able to meet a goal, right? So I want to make money, but I also want to fulfill my purpose. So as you know, HEDIS hiring season is already underway to start preparing. Okay, so don't wait until an interviewer asks about coding, HCC, CDPS, or risk adjustment to realize you need more training. Start building those skills right now. Click on the link in the description to learn more about AIMRRA 3-for-1 Career Bundle. And remember, training does not guarantee employment, okay? But the training is going to get you ready for that interview. It's going to let you know what you need to focus on, the pinpoints, and also we also talk about how to negotiate your salary. We talk about a lot of things in this training. All right. And this is real life, real world approach for applications. So you're going to learn how to interview with more knowledge and confidence. Okay. So 3-for-1. You can't beat that deal. Click on the link in the description. Thank you for watching. Please like this video, subscribe to AIMRRA channel, and share care professional who's interested in HEDIS, medical coding, risk adjustment. All right, guys. And even if you want to go up from a HEDIS professional, a medical coding professional, and you want to go into a management position or an executive leadership position, this is the course for you. This is Dr. Lanette with AIMRRA. Until next time, continue learning, continue growing, and continue preparing for your next opportunity. Bye-bye.